Yeah. Just a minute. Today, the Medskool is Traveler with Jaundice. That's the title. Okay, see carefully here. See the question based on that we'll discuss. A lot to discuss. Very important topic. We may get a question on this. A 46-year-old man, every word is important, comes to the physician because of 1 week history of headache, muscle pain, and recurrent fever spikes that occurs without a noticeable rhythm. Now this is 1 week duration. Headache, muscle pain. It may be CNS problem. We don't know. We may be any other infections. We can't say. Just we can go through the recurrent fever spikes. It may be relapsing fever. Many things come to your mind. Okay. 2 weeks ago, history is very important. 2 weeks ago, he returned from a 5-week long world trip during which he climbed several mountains in our country, Africa and Appalachia. So he traveled, something travel related. Chemoprophylaxis with chloroquine was initiated 1 week prior to the trip. So time to rule out malaria. Possibilities are there because he knows he is traveling many malaria endemic area. So he took chloroquine. These all come to your mind. Okay. Physical examination shows jaundice. Yes. Jaundice, you can give 100 DDs. Lot of DDs are there for jaundice. The spleen is palpated 2 centimeter below. Just a second. Okay, I'm adjusting my this one. Sorry. Okay, now okay. So spleen is palpated 2 centimeter below the left costal region. Splenomegaly is there. Hemoglobin concentration 10 gram per deciliter. Hemoglobin low. He's having some kind of anemia. A photomicrograph of the peripheral smear. So whatever it may be, even though he is taking chloroquine, people give a peripheral smear shown in the image. See the peripheral smear. Peripheral smear shown in the image. Which of the following agents most likely caused the patient's finding? This is the question. He is a traveler. He is having jaundice. Okay, hemoglobin concentration is less, splenomegaly present, and he already took chloroquine as a prophylactic measure. See the RBCs. Inside the RBC, they have some inclusions, specific inclusions. Okay, what may be your diagnosis? Here I give 4 choices. Still we have a lot of other. Differential diagnoses are there. Okay, it may be trypanosoma cruzi infection. It may be Plasmodium ovale infection. It may be Plasmodium falciparum, Babesia, Plasmodium malaria. Lot of Plasmodium choices are there. Okay, very simple. I will rule out trypanosoma cruzi. First we'll come to the conclusion, then we'll discuss one by one. Trypanosoma cruzi, because in peripheral smear it produces hemoflagellate. We call it as hemoflagellate trypomastigote. Trypomastigote is the diagnostic. You can demonstrate trypomastigote. How the trypomastigote look like? See carefully here. This is the trypomastigote. Typical trypomastigote. People say, and now itself they're going for answer C, D's are like that. Don't worry, relax. I'm sorry, trypomastigote. It is not trypomastigote. It is intracellular inside the RBC something. Okay. So inside the RBC we need to think of 2 people, Plasmodium and Babesia. And I will rule out Babesia. How I can rule out Babesia? Because Babesia, listen to me carefully. inside the RBC, you have a typical structure called Maltese cross appearance. I'll rule out Babesia because you are having rule out Maltese cross appearance, and there is absence of pigment. That's an important clue. Who mentioned this? Monisha Jand. Sorry, absence of pigment with Maltese cross appearance. I will remove Babesia from my choice. Okay, among the choices, see carefully here. This is maybe Babesia. See carefully. You can have beautiful Maltese cross appearance. Maltese cross appearance from Babesia. Okay. So other choices are Plasmodium. So it's maybe one among the Plasmodium. Which Plasmodium? That is important. That is important. Before coming to conclusion, most common agent and severe agent is Plasmodium falciparum. Plasmodium falciparum. Okay. Each one you should know how to diagnose. That is the way today I am going to teach. So if you are confirming, we are diagnosing it as Plasmodium infection. I'll stop here. We will discuss something related to Plasmodium. After knowing the complete theory knowledge, then again we will approach the question. We will know what is the answer. Many people say answer D, many people say answer C. C or D. Okay. Or E, it may be Plasmodium malariae. We don't know. So Plasmodium is an infection. It's a protozoal infection. It infects all the RBCs. It infects RBCs only. It infects RBCs only. Just a few points. And the definitive host is female Anopheles mosquito. Just recollect. Mosquito. And intermediate host is human. And usually transmission via mosquito bite. Usually transmission via mosquito bite. Okay. Everybody aware of life cycle. Just a few 2 to 3 minutes. You can understand the life cycle one more time. You consider this as a revision. Don't get bored, my dears. This is important. See, if you see the life cycle, all Plasmodium, what happens? Mode of transmission in infective mosquito bite. Infective stage is porozoite. This is the important question. Infective stage is porozoite. Okay. Next is it enter into liver cells. This is called pre-erythrocytic cycle. It enter into liver cells. We call it as pre-erythrocytic cycle. Inside the liver cell, they turn to be merozoites. These merozoites form ring form. They turn to be trophozoite inside the RBC and scions inside the RBC. Again they become merozoite. Life cycle continue. This is called erythrocytic cycle. It may vary from species to species. I'll tell you. Because of that breakdown of RBC, they have chills, rigor, everything. And after that, they turn to be gametocyte, male, female gametocyte. These gametocyte, so this is called pre-erythrocytic, this is called erythrocytic. Pre-erythrocytic and erythrocytic. Next, gametocytes taken by mosquito. Gametocyte taken by mosquito. These gametocytes, they fertilize each other, they turn to be sporozoite in the salivary gland. That is happening inside the mosquito. That is happening inside the mosquito. Don't worry. This is basic life cycle. This is happening in all Plasmodium. All Plasmodium species, this is happening. But some Plasmodium has one extra cycle called exoerythrocytic cycle. What is it, sir? Especially Plasmodium ovale and also Plasmodium vivax. Plasmodium ovale, Plasmodium vivax. Inside the liver, they settle in the form of hypnozoites. Inside the liver, they turn to be hypnozoites. These hypnozoites settled in liver for some period of time. After that, they turn to be merozoites. Again, life cycle continues. Okay, so they are responsible for relapse. They are responsible for relapse. This is basic life cycle of Plasmodium. All have two life cycle, two stages, pre-erythrocytic, erythrocytic. But the vivax and ovale has three stages, pre-erythrocytic, exoerythrocytic and erythrocytic. Hope you understand everything. And here I want to mention one thing. Mode of transmission. Don't think only mosquito bite. You can have transfusion also. Blood transfusion. Blood transfusion also mode of transmission. Another thing is placental transfer, mother to child. Placental transfer. These are all other mode of transmission. Blood transfusion, placental transfer. Okay. Sir, what is the infective stage, sir? You know the mode of transmission. Mode of transmission, we have three. One is mosquito bite. That is normal. Mosquito bite mode of transmission is sporozoite. Infective stage is sporozoite. That we know that. Where blood transfusion, the important is trophozoite. Meninflow, trophozoite. Placental transfer usually merozoite. Merozoite and trophozoite also. These people because they're inside the RBC. They're inside the RBC. Inside the RBC. Transfusion, trophozoite, maternal merozoite. They used to teach like this when I was studying. They used to teach T for T, transfusion, trophozoites. Who mentioned? Janvi, yes. Maternal merozoite. But no problem. These are the infective stage. And what important thing, in case of blood transfusion, in case of placental transfer, they miss absent. There is absent of pre-erythrocytic stage. Go to what is called liver, they turn to be merozoites, coming to circulation, missing. Directly they go to circulation. So there is absence of pre-erythrocytic cycle. There is absence of pre-erythrocytic cycle. Yes, my dear. Sonal Narwani, I will share. Okay. Malaria, I will make 10 flashcards. I will share 10 flashcards by today. Don't worry. Today or maximum tomorrow morning. Because today, even some commitment, it take half an hour to 1 hour extra time. I will do that. I take this as a homework. In my Micromagics group, exclusive Plasmodium, 10 flashcards. That's all. After that, no need to read Plasmodium. Absent pre-erythrocytic cycle. Beautiful. That's all, my dear. And now, this is interlinked. Can you tell other protozoal infection by blood transfusion? Blood transfusion, otherwise called transfusion transmitted. Transfusion transmitted parasitic infections. Transfusion transmitted parasitic infection. Okay, transfusion, whole parasite. Micro it is available. All flashcards available in the group. Almost 500 flashcards available. More than 500. Just to go through this. Transfusion transmitted. Who beautifully answered? Partha. Dr. Partha beautifully answered. Babesia, very good. Babesia, trypanosoma. So follow the mnemonic. Okay. BPL, TT. These are all transfusion transmitted. Babesia, people beautifully answered. Plasmodium. Leishmania. Trypanosoma and toxoplasma. Trypanosoma and toxoplasma. Please remember, that is important. BPL, TT. See this flashcard. Yeah. Transfusion transmitted infection. Parasitic cause. Even bacteria can cause. Okay, syphilis, those kind of things. Virus, HIV, hepatitis B. Many are there. But common. Toxoplasma, trypanosoma. So BPL, TT is my mnemonic. BPL, TT. Thank you, Narayana Swami. Thanks for compliment. My flashcards are amazing. I'm making for you people only. Make your use of it fully. Not Giardia. Not Giardia, Dr. Sonal. Giardia is intestinal pathogen. Okay. That's all. Next is. Coming back here. So you know the transmission and you know the life cycle. Now you need to know something about the species. There are 4 species are there. One is called major species. There are more than 4 available, but common 4. One is called Plasmodium falciparum. Plasmodium vivax. Plasmodium ovale. Plasmodium malariae. Falciparum, vivax, ovale and malariae. Plasmodium vivax, ovale, malariae. These 4 people. Here what you should know, the erythrocytic cycle. This is important MCQ. Erythrocytic cycle. It may differ. It is 48 hours. This also 48 hours. This also 48 hours. And this is 72 hours. 42, 42, 48, 48, 48, 72 hours. So what is the name of the disease they cause? This important MCQ. Falciparum causes malignant tertian malaria. Vivax causes benign tertian malaria. Malignant tertian malaria, benign tertian malaria. Ovale is called ovale tertian malaria, where Plasmodium malariae causes benign quartan malaria. Benign quartan malaria. Okay, benign quartan malaria. All benign tertian, very good, 48, except 72 hours. 72 hours is Plasmodium malariae. This one you need to concentrate. Apart from that, based on the life cycle, listen to me. These people, vivax and ovale, they causes relapse. And malignant, this falciparum and this fellow, Plasmodium malariae, they cause recrudescence. Now time to learn what is relapse, what is recrudescence, what is reinfection. Relapse is biological state. Normally, biologically, the organism become dormant, they become hypnozoids, again they cause the disease, that is called relapse. Recrudescence, very important my dears. Recrudescence, lot of confusions people develop. It is due to treatment failure. Because of treatment failure, poor treatment, incomplete dose, some of the parasites, they reside in the RBC itself. They are not cleared. They are not properly cleared. They happily settled in the RBC for some more time. Though they multiply, they cause recrudescence. It is seen in malignant tertian malaria and benign quartan malaria. What is reinfection, sir? Complete cure of malaria. After that, he was infected with some other strain. Relapse is normally biologically they stay inside, they cause disease. Because of treatment failure, they cause disease, recrudescence. Complete cure. In Chennai I had malaria, complete cure. After that I'm going to Mumbai. Then I got mosquito bite. I got again malaria. Then it is called reinfection. These three things you please note down. Okay, these were some of my flashcards will help you. See here. RRR in malaria. What is relapse? Parasite is maintained in liver cycle long time due to reactivation of dormant parasite. Reactivation of dormant parasite in the liver. It's a physiology, biological. It's normal biological. And what is recrudescence? Many people get doubt. Parasite maintained in RBC for a long time due to treatment failure. Please note it. Due to treatment failure. What is reinfection? It's a second infection that follows recovery from the previous infection, same causative agent, due to new infectious mosquito bite. I will get malaria in Chennai, completely cure, and new malaria at Mumbai or some other place is called reinfection. Please remember RRR. Relapse, recrudescence, reinfection. This will help you because in the exam you may get confused which causes. Relapse is called VO, Vivoxan ovale. Recrudescence is malariae and falciparum. FM, recrudescence. Reinfection, anything may cause. All will cause reinfection. Don't worry. Next is, this is the famous mnemonic. All my regular DAMS kids aware of that. What is the mnemonic for the disease caused by Plasmodium falciparum? Completion's sake, because we need to know, we need to touch some clinical picture. Okay, yes, Plasmodium falciparum the important clinical picture is B.A. Chaplin. This is my mnemonic. Just you can recollect. B.A. Chaplin. Very good, Akash. Yes. Don't get bored. This is very important mnemonic. It is causes black water fever. Why black water fever? Hemoglobinuria. RBC's breakdown. It causes autoimmune hemolytic anemia. Algid malaria. What is algid malaria? Cold, calmy skin. Cerebral malaria. Very fatal condition. Hypoglycemia. Many times people remember B.A. Chaplin, they forget the content. That is important. Autoimmune hemolytic anemia. Pulmonary edema. Pulmonary edema. Lactic acidosis. Lactic acidosis. Secondary bacterial infections. Acute tubular necrosis. Renal, it's called necrosis of renal tubule. We call it as acute tubular necrosis. Be a Chaplin. Autoimmune hemolytic anemia. Yes, you are right. So these are all just for completion's sake. We know you are all aware of that. If you already, the kids who already attended my class, not an issue. They are aware of that. Some new kids may be there because it's in YouTube. It's in YouTube. Some non-Damsonian kids also may be there. I need to teach them everyone. I'm sorry. Some allergic reactions happen. Necrosis of renal tubule. Yes. Now, very important lab diagnosis. I am going to concentrate on the next 15 minutes. Lab diagnosis. It is important. We may get lot of questions. You may get lot of questions. Lab diagnosis. And important thing is peripheral smear. Peripheral smear. We have thick smear and thin smear. Thick smear, you can know the count, quantification. Thin smear speciation. Can you name the name of the stain? Can anyone name the stain? What stain we are using? Lot of stains are there. But very traditional stain is called JSB stain. Jaswant Singh Bhattacharya stain. That is a traditional stain. Traditional stain is, yes, Akash beautifully mentioned. Akash is fire. Okay, right. Thick smear quantification, thin smear speciation. Okay, right. Listen to me carefully. What stain we are using? Jaswant Singh Bhattacharya stain. We are using Jaswant Singh Bhattacharya stain. And always Jimsa stain. Or Leishman stain. Anything we can use. Leishman stain. By seeing RBC itself, because it is inside the RBC, they form some diagnostic structure. Diagnostic structures. We'll see one by one. Don't worry. By seeing RBC itself, we can say which parasite it is among the 4 parasites. Some of them infect young RBCs. Some of them infect mature RBCs. Some of them infect younger mature, all RBCs. Got it? This is more dangerful is Plasmodium falciparum. It infect all the RBCs. Young, mature, all. Okay, see this picture, this will help you. These are all my flashcards for you. See here. Affinity of malarial parasites to RBCs. Young RBC by Vivox and ovale. People who cause relapse, usually young RBC. Old RBC by malaria, specifically. But young or old by falciparum. So falciparum, young or old. And Plasmodium malariae, old RBC. Young RBC, you can have Vivox and ovale. So if old RBC is infected, it may be falciparum or malaria. If it is young RBC, it is due to all except malaria. Young RBC, Vivox, ovale, even Plasmodium falciparum also. Hope you understand. This picture will be helpful to you. Little bit comical, but definitely it will be helpful to you. Okay. Next is, see carefully here, one by one. I'll start with Plasmodium falciparum. Plasmodium falciparum. The key diagnostic point is inside the RBC, you are getting multiple ring forms. That is very pathognomic. We call it as headphone. We call it as headphone or smiley trophozoites. It is otherwise called Acol formation. That is diagnostic of falciparum. Or Inside the RBC, you are getting banana and boat-shaped gametocytes. Banana or boat-shaped gametocyte. Banana or boat-shaped gametocytes. 48 hours is the erythrocytic cycle. It produces recrudescence. Recrudescence. Okay. Next is Plasmodium, and it infect old and young RBCs. These are all the key point. And they possess pigment, hemazoin pigment. Okay, we call it as Meyer's dot. The hemazoin pigment is called Meyer's dots. Meyer's dots. Dr. Rachna has big questions of where I can find flashcards. In my group, Micromagics group, Telegram group. People are aware of that. Next is Plasmodium vivox. Plasmodium vivox. It affects young RBCs. Young RBCs. And important structure, RBCs are enlarged. That's a clue. Enlarged RBCs. The RBC size is increased. And the trophozoite is amoeboid trophozoite. Here, headphone shaped smiley trophozoite, vivox, amoeboid trophozoite. I'll show the picture. Amoeboid trophozoite. And it possesses hypnozoites. It associated with relapse. And erythrocytic cycle 48 hours. Erythrocytic cycle 48 hours. Hypnozoites, relapse 48 hours, young RBCs, enlarged RBCs, and amoeboid trophozoite. How it look like, sir? See carefully here. This is amoeboid trophozoite. I can show you. Yeah. This is called amoeboid trophozoite. Amoeboid trophozoite. Plasmodium vivox. And this is banana or boat-shaped gametocyte. Plasmodium falciparum. Images are important. And it produces Narayanasamy is great. And should be sweet. Schnaffner's dot. It produces Schnaffner's dot. Schnaffner's dots. That's all, my dear. You need to learn 5 to 6 important points. Schnaffner's dot. Even though if you want to this amoeboid trophozoite, I can show one more picture also. See. Plasmodium vivox. It possesses amoeboid trophozoite. Amoeboid trophozoite. See, look like typical amoeboid trophozoite. Amoeba. Amoeboid. Shapeless. Amoeboid trophozoite. Plasmodium falciparum. Acole formation. Multiple rings. Okay. Next is Plasmodium ovale. Plasmodium ovale. What happens? It infects young RBCs. Inside the RBC, jagged oval shape. Because of that we call it as oval. Oval, jagged, okay. Oval, jagged trophozoites. Oval jagged trophozoites. And same thing, it also 48 hours. Hypnozoites present. And name of the pigment is called, it causes relapse. Name of the pigment is called James dots. James dots. We call it as James dots. Name of the pigment James dots. Okay, James dots. See carefully here. Plasmodium ovale. It is oval shape. See, it is oval shape, jagged, oval shape, jagged. Okay, and this is called oval shape and jagged. Plasmodium ovale. Plasmodium ovale, oval shape and jagged. Last man, you should know how to identify. Some important technical word is there. Do not forget Plasmodium malariae. It infects old RBCs. 72 hours. And 72 hours. And do not forget, it produces bar and band forms. Bar and band forms. Bar and band forms. I'll show the picture. This is important MCQ. Acol formation is very important. Another one is amoeboid. You can get in Vivox. Oval shape, jagged in ovale. Here it is bar and band forms. That is very peculiar. Very peculiar. Bar and band forms. It causes recrudescence. It causes recrudescence. See carefully here. This is called bar and, see, are able to see? Superb picture. Bar and band forms. Bar and band forms. This is called Plasmodium malariae. I will show the drawn picture. Yes. Plasmodium malariae band form. See, you can see band form. Bar and band form. Bar and band form. Bar and band form. Make things easy, my dears. Make things easy. Bar and band form. So, it causes recrudescence. It causes recrudescence. Okay, the chysons form like flower-like appearance, rosette formation. Okay, so this is diagnosis. So now if you give the peripheral smear, you can see. And beautifully people mentioned, should be, what is the name of the dot pigment? Siemens dot. Siemens. So Myros dots falciparum, Schnappnus dot vivox, James dots ovale, Siemens dot is for Plasmodium malariae. Got it? This peripheral smear is very important. Apart from that, we have for falciparum, because falciparum is important, we have diagnosis, rapid diagnostic test. We call them as RDT. Rapid diagnostic test is HRP2 detection. One is called, okay, PLDH, aldolase. These are all Plasmodium specific. What is PLDH? Parasitic lactate dehydrogenase. Aldolase enzymes. These are all Plasmodium specific. Plasmodium specific. If it is present, Plasmodium present. Yes, Vivan. Sometimes what they do, they give the picture to you. So don't be panic. If you are able to see pigments, they'll give the name. Pigments you need highly expertise to see. Don't worry. For your level, they will not give pigments, but they will give the name of the pigment. Zimines pigment present, or like that. Or oval produces what type of pigment? James dots, like that they will ask. Don't be panic. Don't get tensed. This is Plasmodium specific. The PLDH aldolose. Once you identify as Plasmodium, next already people mentioned HRP2. HRP2 detection. Histidine rich protein. Histidine rich protein, otherwise called HRP2 detection. Histidine rich protein 2 detection. It is only Plasmodium falciparum specific. Plasmodium falciparum specific. So first what we do PLDH or aldolose screening test. Once it become Plasmodium, then we do HRP2. If HRP2 negative, it is other than Plasmodium falciparum. We conclude this is other than Plasmodium falciparum. Okay, this is Plasmodium falciparum specific. Very good, people mentioned. This falciparum specific. Good. We had some idea. Okay, next is treatment. Another important thing. Treatment, listen to me carefully. In case of Plasmodium falciparum, usually the treatment is chloroquine. But nowadays lot of resistance are there. Because of the reason, in this case he took chloroquine as a what is called prophylactic, but that is not useful. So the kind advice, where there is malaria endemic area people are going, don't prescribe chloroquine as a prophylactic agent. Previously people give chloroquine as a prophylactic. Now we have a lot of prophylactic, lot of chloroquine resistant. Then what is the ideal prophylactic? Prophylactic ideal is atovaquone proguanil. Atovaquone proguanil. That is the prophylactic you can give. Suppose if you want to give treatment, you can give artemisins. Mefloquine is the treatment. In case of severe, you can give quinidine. In case of any severe malaria, you can go for quinidine. Primaquine you should not give for falciparum, my dears. Falciparum for is primaquine, not ichimoker. No. I'll come back to you. In case of Vivox, no resistance. Now you can give chloroquine and primaquine. Why primaquine? Because radical cure. It can target hypnozoites. Primaquine, chloroquine and primaquine confidently you can give Vivox, no problem. That is the recommended drug. Okay. Next is Plasmodium ovale. Same, you can give chloroquine, primaquine, because they produce relapse. Even prophylactic as well as treatment, you can give chloroquine, primaquine. You need to give. But in case of falciparum, no need to give primaquine. There is no use of primaquine. Okay. In case of Plasmodium malariae, just chloroquine. So, except Plasmodium falciparum, because lot of chloroquine resistant cases are there. Lot of chloroquine resistant cases are there. There is no use of giving chloroquine, because the same case, in this case, even though he took chloroquine as a what is called prophylactic, it may prophylactic against vivox, oval, malaria, except falciparum. So he is having falciparum infection, even though after taking chloroquine he is having malaria, means 99% it may be falciparum, resistant malaria. Drug resistant, how we are diagnosing? With the help of PCR, okay. Still not over. Our differential diagnosis, they gave only these people. So I will remove oval. Why it is not oval? Because oval shape, it obey for chloroquine, okay, many things. Plasmodium malariae, it also obey for chloroquine. Which is not obey for chloroquine is this fellow, and all other features look like this one. Jaundice, splenomegaly, these are all common for all malaria. Almost it's common, don't worry. Peripheral blood smear, the dots, brown dot, Myra dot, okay, suggestive of this. And some more differential diagnoses are there. We can suspect other people like Trypanosoma brucei. You know, because of trypomastigote. No trypomastigote. And clinical picture, posterior auricular lymphadenopathy. That's called Winterbottom sign. Just you can recollect. Winterbottom sign. The important feature is Winterbottom sign, posterior auricular lymphadenopathy. And it produces chancre. Incubation period not 1 week. Malaria it is 1 week, around 1 week. Okay, Trypanosoma brucei. One more differential diagnosis, leishmania. Leishmania donovani. Leishmania donovani you can see in reticuloendothelial system. You can demonstrate amastigotes inside macrophage. Amastigotes inside the macrophage, and also we call it as LD bodies, Leishman-Donovan bodies. And features we have ascites, splenomegaly, hepatosplenomegaly, ascites, Kala-Azar, black disease. The clinical picture is different. And we are using an antigen detection called RK39 antigen. Please note down, my dears, RK39 antigen. RK39 antigen. RK39 antigen. Another important differential diagnosis, dengue fever. Dengue fever, you cannot demonstrate any parasite. Here the parasite we demonstrated in peripheral blood. Number 1. And dengue fever you can diagnose with ELISA PCR. And mainly the is called saddleback fever or breakbone fever. We call it as saddleback or breakbone fever. Severe body pain, bleeding, these are the manifestations. But headache, fever, body pain, initially they start. Initial stage of dengue fever, you can. NS1 antigen, yes, should be sweet. Okay, with this, we are concluding this as Plasmodium falciparum infection. We discussed maximum almost all aspects of Plasmodium. We'll see some MCQs. Now the time is exactly 7:50. 5 minutes. Retroorbital pain is the very important feature of this one, Sonal Narwani. Retroorbital pain is feature of chikungunya and dengue. Chikungunya and dengue, you have joint pain, body pain, everything will be there. Myalgia. Both vector is Aedes mosquito, here vector is female Anopheles mosquito. That also you should know the difference. Few MCQs we'll see. After that I can give 5 more minutes time for open discussion. Sharp 8 o'clock we'll finish it off, because the class is 1 hour. They gave me 1 hour. I need to use exactly 1 hour. You people know about my timing. Okay, right. 28-year-old woman, gravida 1, para 0, at 20 weeks gestation comes to the physician with her husband for a prenatal visit. In pregnancy has been uncomplicated. They are planning to travel Ethiopia next month to visit husband's family. Medications include folic acid and iron supplement. Good. Vital signs within the normal range. Abdominal examination shows uterus that consists of 2 weeks gestation. Everything is okay. Which are the following drug most suitable for pre-exposure prophylaxis against malaria? Going to Ethiopia. Okay. Which one you are going to give? Going to Ethiopia, pre-exposure prophylaxis. Pre-exposure prophylaxis. What you people are answering? No, once you have malaria, the treatment is you target hypnozoites. Before entering into malaria, you need to prevent. The best one. It prevent malaria, everything. It is chloroquine. You can go for chloroquine. Chloroquine, my dears, that's a good drug. Chloroquine, pre-exposure prophylaxis, basic drug. Pregnancy, you can give chloroquine. Pregnancy, okay? Simple. Next is, in malaria, the form of plasmodia that is transmitted from mosquito to human. Mosquito, very simple direct question. Sometimes the question will come like this, we will get confused. Okay, mosquito to human is, even first time you can give, my dear. No problem. You can give sporozoite. I will give the guidelines to you. I will release the guidelines. V1, I will release the guidelines. Don't worry. Sporozoite. Okay. Next is Duffy antigen associated with. Sometimes we may get some question like this. Yorker ball. Duffy antigen is, it's important MCQ, hematology. Duffy antigen usually associated with Plasmodium vivox. Duffy antigen associated with Plasmodium vivox. Duffy antigen associated with Plasmodium vivox. Learn some extra points via MCQ. Because of that, I put this kind of questions. Duffy antigen. Yes, Shagil Shah, vivox, you're right. Which type of malaria associated with nephrotic syndrome and renal failure? It comes under type 3 hypersensitivity. Immune complex mediated. Nephrotic syndrome in which type of malaria? Plasmodium malariae. Yes, Janvi, you are right. Malaria. Which type of malaria associated with nephrotic syndrome and renal failure is Plasmodium malariae. It is immune complex mediated, antigen antibody complement. It comes under type 3 hypersensitivity. Yes, my dear, we want CME also probably, yes. We can discuss means we can take discussion anywhere. If I take Duffy as a main topic, I can talk 1 hour on Duffy, what is called Duffy antigen, what disease associated with in presence and absence. That will go another way. Another Medskool I can discuss like this. Yes, my dear, these questions look easy but not easy. Look very easy but not easy. I am putting the MCQs not from my teaching. If I put everything what I taught you, you can get 100% false sense of well-being. No. Learn from theory, learn from MCQ. Both learn. Okay, don't be panic. Malaria recrudescence is due to. This I have already taught you. Recrudescence is due to. Relapse is not recrudescence. Relapse is vivox and ovale. Reappearance of sexual state will not appear after treatment. It's mainly due to treatment failure, resistant to treatment. Now everybody is happily answering because I have taught you, don't worry. Resistant to treatment is recrudescence, where normally biologically they stay sexual state present after treatment. After treatment they, because they're dormant, after they reappear. All called relapse. Gold standard test for babesia. Silly question. Please remember, malaria and babesia, gold standard is peripheral smear. What is the new advanced version? Advanced version is called QBC. Same peripheral smear, QBC. Quantitative Buffy coat analysis. Okay. Gold standard test for babesia is Giemsa stain. Make it very easy. Many people go to PCR. No need. Peripheral smear. Giemsa stain is the old technique. Advanced version is QBC. We are using fluorescent stain. Quantitative Buffy coat. We are using it for here also. Next is Maltese cross is characteristic feature of. It's a diagnostic. If you are able to see incomplete undivided merozoites inside the RBC, Maltese cross is diagnostic of babesia microti. Maltese cross, babesia. Cryptococcus neoformans also Maltese cross present in Polaroid microscopy. If they mention Polaroid microscopy, Maltese cross appearance, you can see Cryptococcus in Polaroid microscopy. But in ordinary microscopy, Maltese cross feature of babesia. Even fat bubbles also look like Maltese cross. Okay, fat bubbles also look like Maltese cross. And Polaroid microscopy, Cryptococcus. But normal microscopy, usual routine, Maltese cross is characteristic feature of babesia, this thing. Yes. Okay. Now the time is exactly 7:59. Yes, one more question. Infective stage in transmission malaria. Transfusion, sorry, it's not transfusion. Transfusion, so typographic error. Transfusion transmitted malaria. You are all aware of that. Is T for T. Transfusion, trophozoite. Sporocyte via mosquito. There is no tachyzoite. Gametocyte is diagnostic stage. That's all. Now the time is exactly 7:59. I will close the class. Hope you all enjoyed this 1 hour. Something related to malaria. Important topic. Go and read any topic. We can discuss in the group. We'll continue the discussion in the group. Thank you very much. God bless you. Thank you very much. God bless you. I am signing off.